Today we are going to be looking at details of semen analysis. What exactly happens when the doctor requests your semen from you as a man for laboratory investigation? What are they looking at? That is what we are going to be talking about in this video today. My name is Chidima. I'm a registered nurse and I live and practice in the United Kingdom. In this channel, we talk about sexual health, reproductive health, generally health topics, and wellness. If that sounds like what you want to be part of, please click on the subscribe button below this video and turn on your notification. Without wasting time, let's get into it. Firstly, what is semen analysis? Semen analysis is a type of laboratory investigation that is done to check the quality of the semen or the quality of the sperm cells that are swimming in the semen. There are two major reasons why semen analysis is done. First is for infertility issue, to look at the quality of the sperm cells the man is producing, to look at the quality of the semen which these sperm cells are swimming in. When it comes to infertility, the doctor will be looking at the sperm count, the motility of the sperm, that is their movements. Are they sluggish? Are they fast? And if they are fast, how fast? And if they are sluggish, how sluggish can they be? The doctor will also be analyzing the morphology of the sperm, which is the structure of the sperm. Does this sperm have normal structure, or does it have two heads, two tails, no tail, or abnormal heads? We all know that the sperm cell have a head and a tail, and this head contains all the DNA materials, all the genetic content, and it is this same head that it fuses with the egg a woman has released for your wife or your partner to achieve pregnancy. Now, another reason why semen analysis is done is to check if the procedure of vasectomy, which is a method of male sterilization, was successful. In the vasectomy, the man will no longer be able to produce sperm into his semen. So they will ask you to bring the sample and they will check if there are any live sperm cells in the semen. So those are the two main reasons why semen analysis is done for men: for infertility issues and for contraceptive purposes. Now that you have known the reason why these sperm cells are analyzed, or why semen analysis is done, how do you go about semen analysis? So for you to have semen analysis done, you are usually advised to abstain from sex for 2 to 7 days. Reason being because they want you to have a lot of semen produced for this sample, because there are so many things that can affect semen analysis, or there are so many things that can affect the number of sperm cells produced. There are so many things that can affect the quantity of semen also produced. So that's why they ask you to abstain for 2 to 7 days, so that the volume of semen produced will be enough for them to do this investigation. Normally, when you get to the hospital, you'll be given a specimen bottle, a sample bottle, specimen container, whichever you want to call it, and you'll be given a private room for you to go in and produce this semen. The challenge now is that so many men do not find it comfortable enough to do that, because emotionally you're affected, psychologically you're affected. It's a hospital setting, I know. So it's weird for you to come and start arousing yourself and ejaculating in a hospital setting. You know that production of sperm cell or ejaculation or arousal for everybody has to do with mind. So it's something you have to get into the mood in. And then you just get to the hospital and you're given a specimen bottle, or given a room, go ahead and produce sample. Like, how do you do that? So prepare your mind. If you have been asked to undergo semen analysis, you'll be asked to go into a room in the hospital and produce the sample. Nothing stops them from asking you to take the bottle, produce the sample in your house and bring it. But the reason why they don't want to doing that is they want to shorten the transportation time of you getting to the lab. Because another thing they want to analyze in that test is what we call liquefaction of the semen. How long does it take the semen to become sticky? So if they give you that specimen container to go very far and take your time and bring the sample, things might go wrong in the quality of the result. So that is that. Now, for you to produce this semen, the best method for you to produce this semen is masturbation. Don't come and tell me that masturbation is bad, masturbation is this. So many men fiddle with their penis, and that is called masturbation. Intentionally or unintentionally. So they just want you to arouse yourself and produce the semen. Your partner can help you get that ejaculation that you want, the arousal that you want. But it is not advisable for you to produce the semen via sex, because the vagina of a woman contains its own normal flora, lactobacilli, which can get into the semen. It has its own pH. It's acidic in nature. That can go into the semen. If that woman is having an STI, that will also go into the semen. So that's why they want you to get yourself aroused, ejaculate by yourself, produce this sample for them directly into the container, which you have been asked to do this. So that is why it is not allowed. Not that it is not allowed. I mean, no laboratory scientist is going to come out and tell you, oh, don't. Normally they'll just give you the bottle and walk away. Except somebody who wants to be a bit more professional will tell you or give you these suggestions, but they will not categorically come out and say, do not use sexual intercourse to produce this semen. You get what I mean? So that is that. Now, do not make the mistake of producing this semen in a condom. That latex material called condom has some contents in it that can reduce the movement of the sperm. So when the result comes out, they will tell you that you have poor motility. That is because of the method of collection of this semen. So method of collection of semen is very important with regards to the outcome of this result, or with regards to semen analysis. So you need to be very careful on how you produce the sample. Let me also prepare you that it is not only once. The doctor might make you go back to the lab again to produce another sample for them. You can be asked to do this weeks after the first one. The reason is because there might be some indices in that result that makes the doctor put a question mark in the result, and believing that result becomes more difficult for the doctor, and they want you to go back to do it maybe 2 or 3 times before they can come to a tangible conclusion of what the problem actually is. If the reason why you're going to the lab for semen analysis is because you have undergone sterilization, vasectomy to be precise, they might send you back more than once as well, because they just want to make sure that every semen you now produce after that surgery do not contain any sperm. That is that. Anyway, this is where we'll be ending this video today. I hope you have learned a lot as to why you are always asked to produce semen whenever it comes to infertility issue, or when the doctor can ask you to produce your semen for laboratory investigation, and what is done and why it is done. I hope this video have enlightened you on that. Before you click out, consider subscribing to the channel. Turn on the notification bell besides it, and give this video a like or a thumbs up so that YouTube can recommend it to others. I will see you in my next video. Have a good day. Bye.